Hi, everybody.
Today's
We
a
woke
very
up this morning.
sad day.
My mom flew to Las Vegas last night. And,
Talk about feeling freaked out when you know people are there. And in fact, I want to just, my heart goes out to Natalie, who works for us. She actually manages our social media, and 5 of her friends were in Las Vegas, and one of them was shot. Fortunately, it was not a fatal wound, but talk about terrifying. So our thoughts and prayers go out to anyone who had family members there or who was involved in this.
Well, and it's something we've actually thought about here at Amen Clinics for a long time. In the brain imaging work we do, we have scanned over 100 murderers, 500 convicted felons, and we know that there is a brain component to it. But the fact is, there are a lot of people who have very troubled brains that don't ever do anything violent. So it is not an excuse. It's not just a brain issue, but the brain is part of it.
So we really need to, I feel like we need to talk about the psychology a little bit, because we're seeing more and more of this. And it's really easy, if you live in the US, it's really easy to go, it's guns. Okay, I know that's the easy, quick answer, but it's not just guns, okay? Because if you live in other parts of the world, it's car bombs, it's driving cars into crowds, it's people running into crowds with knives. It's, if people have evil brains or damaged brains or whatever you want to call it, we've got to figure out what that psychology is. We've got to figure out what's going on.
Well, let's talk about, whenever we assess someone here at Amen Clinics, we always take a 4-circle approach. And I think in understanding violence of any sort, that yes, there is a biology of violence. People who have lower frontal lobe function are going to be less able to inhibit the dark, evil, awful thoughts they have. People who have left hemisphere damage, especially damage to the temporal lobe, are more prone to violence. For people who've seen my TED Talk, I talk about my nephew who attacked a little girl on the baseball field for no particular reason. Out of the blue, he ended up having a cyst the size of a golf ball occupying the space of his left.
And he could have easily become one of those shooters.
He could have been one of those shooters. And when we drained the cyst, when we got it out of his head, his behavior went back to being a loving, sweet person. So there is clearly a biology to violence, usually left hemisphere for right-handed people, temporal lobe, frontal lobe, and there's a literature on that. There's a literature on, but it's not. But that's just one of the circles. Right. So there are biological factors involved in violence. There's psychological, as you were alluding to. There's also social.
Right, and I think, and there's spiritual, and I can't help but think that. I cannot help but think that when people are spiritually bankrupt and they haven't developed a meaning and purpose deeper than themselves, beyond themselves, it's got to contribute tremendously to this, especially if you add that on to a brain problem.
Or the spiritual side goes haywire, and they end up believing that if they murder a lot of people, that's their purpose, to go to heaven with the 70 virgins. And I'm like, the worst thing I could think of is hanging out with 70 virgins.
Okay,
there's nothing
let's not get sidetracked here. Please get back on track. This is serious. What I want to be careful of is I want to really talk about the serious issues, these 4 circles, because talking about the weapon that whoever these people are that do these things is like putting, for lack of a better expression, in the trauma unit, I'm a trauma nurse, it's like putting a Band-Aid over a bullet hole. Okay, it's like covering the issue. It's without getting to the root cause. Because if we take away guns, if we take away bombs, if we take away whatever the weapon is, they will find another way. They'll find another way. So we've got to figure out what's causing these people to do what they're doing. Right. Why are they doing what they're doing?
Something is going wrong in their brain or in their psychology, and often people who commit violent crimes, and I've seen this in my practice, will have witnessed violence themselves. They will have either been the victim of abuse, or it's part of the social norm that they grew up in. There's an interesting study where they looked at murderers from good homes and murderers from bad homes. And they went, so who had the worst brain? The murderer from the good homes or murderers from the bad homes? Well, it was really clear. It was the murderers from the good homes, because they didn't have a psychological framework of violence. So if you grow up in a gang-infested area, violence is part of your mindset. It's part of the community. It's part of what you grew up with. If you're like Andrew, my nephew, where there's no violence in his home, where grows up with a great mom and a great dad, it's much more likely to be his brain, right? And
so, but it does beg the question, okay? It begs the question, because I grew up in a chaotic environment, drugs and, you know, just constant stress and chaos. Yeah, well, my uncle was murdered, but there wasn't like that type of violence continuously going on. But what causes someone else who grows up in probably even less of a chaotic environment than what I grew up in to go that direction versus someone who grew up with...
So you have to understand the circles. And brain trauma is a huge cause of violence. And, you know, we've talked about it. The big NFL study that we did, there's a very high incidence of domestic violence and arrest. Right. I mean, they went like 6 years straight where at least once a month an NFL player was arrested, and often for a violent act that they would commit.
And yet you have some people who become like the extreme protector when they grow up in those environments.
Right. Again, thinking of those four circles. So less likely that they had a significant brain injury, less likely that there is the psychological vulnerability to violence, so the automatic negative thoughts that come into their mind. How did their mother handle stress-filled situations? How did their father handle stress-filled situations? How did their peer group handle stress-filled situations? And then there's the social circle, which is, well, what's normal in the people you hang out with, right? So for some people, violence is normal. For some people, it's clearly not normal. And then, you know, I always come back in talking to my patients, what's the spiritual circle like? Why do you believe you're on the planet?
Right, what's your purpose?
What is your deepest sense of meaning and purpose? And like you were
Without
saying,
a purpose, a man will perish.
If you're bankrupt, then if you're bankrupt or it's deranged, then you're more likely to commit a heinous crime. So one of our friends, Byron Katie.
Right, she was the first one that came to my mind because she has a terrible brain.
She did, and she had terrible behavior.
Initially.
Before she had her epiphany. So for those people who don't, she wrote a wonderful book called Loving What Is. And, we were published by the same imprint at Random House, and I was going through a hard time, and I read her book, and it was so helpful. And so I asked my publisher if she could send me her email so I could, thank her for her work. And subsequently, she came to the clinic, we came to her house, we became friends. And when I read her story, she was a nut. She was a rager.
Right.
She was an alcoholic. She had an eating disorder. She was not healthy in 1986 in Barstow.
And she had some pretty ugly thoughts to go along with it.
She woke up on the floor of a halfway house and realized that when she believed her thoughts, she suffered. And when she didn't believe her thoughts, she didn't suffer. So this is purely the psychological circle. And so when I met her 20, 30 years later, she is the most serene, peaceful,
she also developed
spiritual teacher.
But she's also developed her spiritual practice as well as her social circle.
Right. So, but when I scanned her brain, it was the brain of a murderer. And I've done 100 murders, so I know what a brain of a murderer looks like. But she wasn't. And why wasn't she a murderer?
Right.
Because she had taken the psychological circle and the spiritual circle, really worked those muscles to be very strong, had a good social support system that were able to overcome the brain pattern of violence.
So I think it's really important, you know, as we speak to our community, they come to us for a reason. And many people know someone suffering with some of these symptoms. They know someone that they know that is suffering with either, you know, severe depression or ugly thoughts or behavioral issues. And her story is classic of what I think is the perfect reason to know there's hope. That if you know someone suffering, please come get help. Because what I love about our work more than anything is that we know that by intervening before something happens, we can change the trajectory of people's lives. And that's what breaks my heart when I read these headlines.
And there's so much hope.
It's just so
that
sad.
You can be better, or people you love can be better with the right intervention.
Please get help. You can call our care center, call someone, and just reach out to somebody.
Thanks so much.